My parents are carriers of the sickle cell trait, and so I've had it all my life. It really doesn't feel like nothing on a typical day, but when you do experience the sickle cell crisis, it's very painful. Your body aches, you get tired, you just aren't able to cope. I've been saying this since I was a kid, but whenever someone asks me what does the pain feel like, I say that it feels like someone is stabbing you and like twisting the knife. It's very painful.
People are dying. That's why we set up this clinic. Patients had no access to care and were just using the emergency room. If this clinic weren't here, the patients would just be doing what they did before, which was patching together care and not having an outpatient provider who knew what they were doing and could take care of them.
Sickle cell is a hereditary disease. It is called a recessive disease, meaning that you need to have 2 copies of the gene, one that comes from the mother and one that comes from the father, in order to have the disease state itself.
Well, it's a multi-system disease. I mean, and there's widespread organ damage. You name a system where there's some damage. It's not just pain.
Sickle cell is commonly found in those with African descent and those of South American, Central American descent. And so we have both of those patient populations living right here in South LA.
There are probably 90 to 100,000 patients in the United States and about 7,000 in the state of California.
As a kid, it was tough. I wasn't always able to do everything, my friends could do. I would miss days of school. Kids would ask, "Where were you? You were gone like weeks." When I was younger, I would, have maybe a crisis like at least 3 to 4 times a month. My son was born premature, and it was due to me having a sickle cell crisis. It was tough in the beginning when he was a little younger because he wouldn't understand, like, mommy's sick and she's in the hospital. And he was like, "Mommy, why are you in the hospital?" But now he understands. I may run into an issue where I'm feeling pain and not so good, and so I will have to find someone to watch my son if I need to go to the hospital or anything like that. Some jobs just won't understand that you can get a crisis anytime, you can get sick anytime, and it will have you taking days off of work. Any type of stress can trigger it, any type of worrying. So I just try to remain in a peaceful state of mind and just kind of go with the flow of things.
Sickle cell used to be a pediatric disease because people didn't live long enough to have it as an adult disease. And so finding pediatric hematologists who manage sickle cell is very easy and common, but finding adult hematologists who've managed sickle cell is actually a lot harder.
It's very close to the Arizona border. It requires a team approach because it's a chronic illness. It has not only medical, clinical issues, but also psychosocial issues, economic issues, socioeconomic issues. We have to do comprehensive care. Every organ system, we check all that. But unless you do it in a clinic like this with people who know about sickle cell and are familiar and comfortable and know the issues, patients just don't get good care.
Big day tomorrow?
I have to go down to Orange County and see patients.
We all know that when you have the best insurance, you have access to those good doctors and clinics and physicians. And so I haven't always had access to good caring doctors and having the right physician for you and that knows you and your condition. It's been challenging, finding the right clinics and finding the right doctors.
We try and get everybody on hydroxyurea, which prolongs life by 9 or 10 years, raises the hemoglobin, prevents organ damage. We try and avoid narcotics, but some patients, they have horrible pain, so they do need narcotics. They try and manage at home. Getting proper rest, not stressing yourself, not going up into high altitude, not getting cold, that kind of stuff. Just stress management, but sometimes you just can't prevent it. The primary team, which is myself, the nurse practitioner, and the social worker, plus Anthony, the community health worker, all sit together and talk. It takes a lot longer. We can't see as many patients, but the patients really appreciate it because they get everything they need. It's not like going to a private practice where you would see somebody for 10 minutes and you don't get a lot of intense care.
I'm originally from Maryland. I moved to LA because overall I felt that it was better for my health because this is warmer weather here, the environment, the food, the community. I Googled sickle cell clinics in the Los Angeles County area and not many came up. So when they popped up, I was like, oh, perfect. Like, let me check this out. And then I did the echo. They make me really feel like at home, like it's my own personal doctor that I can just call anytime. They're very open and that's what I like about it.
I think people are actually feeling better. They're coming in, they're getting good care, they're staying out of the hospital, and they feel like there's someplace that cares about them. I hope this clinic, continues to grow and that we can see more patients. And my biggest concern is that we don't have anybody else like myself who can follow or come into this clinic and be the next hematologist. It's a problem all over the country. It's very hard to find somebody who's interested in adult sickle cell care and who wants to do this.
I feel like I am really healthy. I feel like California has been a great move and the best decision I've made, especially for my health and my son and my family. On a day-to-day basis, I'm just really being a mom, taking my son to school, making sure I'm in good shape, making sure I'm healthy, and just trying to enjoy life.